So addiction treatment and the integration of a certified peer recovery specialist. So I was just, whenever I was told that, or asked to do, well, voluntold to do this echo, I really think about the CPRS role, and I think about it being integrated, because that's essentially what's happening all across clinics, is the integration of this new role into the interprofessional disciplines. So, just figured out what financial disclosures were. Evidently, I have none. I was told I don't have any either. So, but you can pay me in chocolate if you have chocolate. So I was trying to make this a little bit more interactive and use Menti. I know probably people know Menti. And it was just asking basic questions because I wanted to see how many people has been affected by substance use disorder, whether personally or professionally at all with close friends. But it's not going to work. The link won't work. Just to see the numbers. I don't want to know like how, so if you are willing to, just to put it in the chat, just say, you know, Y for yes, N for no, if you've ever encountered it personally. It would just be something to see, just to see a percentage of people that's actually dealt with it personally. Again, not themselves or even just a close family member, just to see how far addiction reaches. So before I get into this and read, because if I even try to start reading off of this, I'll just go ahead and get sidetracked. So a certified peer recovery specialist is somebody that the state of Tennessee recognizes with 2 or more years of sustained recovery. And that's either from a mental illness, a substance use disorder, or both of what we call as co-occurring. Me personally, just a little snippet of me, that's it really, CPRS is telling people that you have to be transparent to a state as your professional role, but kind of allowing you to be transparent in your profession about your personal life, your personal vices, and your traumas and struggles of the past. So but that's what makes it essential. That's what makes this role completely essential in substance use disorder programs and treatment all across the board, because the identification factor alone is enough to gain as much trust as you need just to even try to sprinkle a little bit of hope in somebody's life to come back to that next clinic visit. It is. And sometimes, and I was having this discussion with some of my students this morning, that sometimes identification isn't always it, right? So as a certified peer recovery specialist, although I can say, hey, I've been there, I've been through these things, sometimes it depends on their stage of change if they even care. You know, sometimes they don't care, but you plant that seed. 9 times out of 10 they do, and it helps open that door for treatment. And not only opening the door, but a sustainable door that they'll continue to come in. Because I can sit here, and another vital piece of working as a certified peer recovery specialist, and I'll get to a little bit more in my own personal role, but if anybody knows anything about a certified peer recovery specialist, it is pretty much Bible in training. You do not push your own type of recovery on anybody. Allow somebody to discover their own type of recovery, their own pathway, because as we all know, it needs to be patient-centered. And I always love this. I don't know if anybody's ever heard it. I can't even remember where I originally heard it. I think it was from the book Chasing the Screen. But what is the opposite of addiction? It's connection, right? So feeling that connection with another human being, and especially especially for me, when somebody was trying to speak to me, whenever I was trying to find help, I immediately had that barrier of, I'm unique. You don't know what I'm going through. I don't want to hear it. Because I wasn't in a place of any kind of change, or I was in pre-contemplation. I was still very much in tune with my victim mentality, in tune with my trauma, and I was reliving that every day. And And the moment that I had somebody tell me, I remember even where I was, that I saw them in a professional aspect, and they told me that they had recovery, well, first, or that they had been where I had been. First, I didn't believe it, but then they started talking, and, you know, one addict can recognize another addict. And I started to listen, even if it was just for a little bit, I started to listen. So patient engagement equals patient safety. The importance of building the rapport, these statistics that I was a part of a webinar, and they just blew me away. So there was a study taken as behavioral health group. I believe it's in Georgia. I might be wrong on that. There's 86% of patients show up for their first MAT appointment with a peer, and 72% of the patients are still in treatment after 30 days, compared to only 45% still engaged in treatment with facilities without a peer. So follow through, you know, as any health professional knows, it's the follow-up that matters. It's not the consultation, not sitting there, them in front of you, because I've even made the mistake before as a CPRS, trying to fill them up with so much hope, and this is what we can do for you, this is your treatment plan, and then we never see them again. So I really think being a certified peer recovery specialist and having that integrated into whatever profession that you're doing with substance use disorder is vital, because that helps somebody come back that, okay, well, I don't trust, because a lot of us have medical trauma, right? We feel judgment, we feel stigma, and this is just the different type of treatment centers that you'll see peers in. But knowing that a peer is there helps them come back, be like, okay, well, I'm still weary about doctors, weary about therapists, but there was that one girl in here that talked kind of crazy like I did, so I'm going to keep coming back. And that's huge for follow-up, huge for harm reduction, huge for just for the hopes of somebody maybe willing to listen for the next appointment. I added a little bit about stigma in here as well. You know, our role is to not only develop rapport, help somebody navigate their own way of recovery, what that looks like, help them with their treatment goals, but it's also helping them holding their hand through the stigma that they're going to face whenever they come into treatment. Treatment is highly stigmatized. I'm sure we have all felt stigma, some maybe not, but in some way, shape, or form, because stigma crosses all domains rather than just substance use disorder. So I think that's one of the hardest things, especially when coming into any kind of treatment, but especially medically assisted treatment, for somebody to tell them that they don't have, that it's not recovery because of they're substituting one for another, right? The stigmatizing language that we hear that is sprinkled, well, splattered all over the place. The consequences of the stigma is people never walking through treatment. There was other statistics on that same webinar, and I can't remember, but it was a disgusting number of how many people actually walk through treatment doors and never, ever even try because of stigma alone. I mean, it was outrageous. I think it was 10% of people with an actual substance use or alcohol use disorder only ever cross the threshold of a treatment center. And I'm at that point in my own professional life and in my own recovery, with people dying at the rate that they are right now. I don't care what brings you in. I don't care if you hate me or anything else. How do I make you live another 24 hours? It's just that simple. You know, how do we show compassion to another human being and the value for their life? And this is the kind of stigma that we face every day with our patients. And even so, I'm also a licensed bachelor's of social work. Moving up in my career and seeing the stigma to try to get people resources is hard too. It's very hard, but I digress. So we judge what we don't understand. So if you got anything from that little snippet, is if you don't understand it, educate yourself, look at the evidence, and keep your personal, if you're working in a professional atmosphere, just try to look at the person as a human being rather than the problems that they're presenting in front of you. And just a little bit about stigma as a certified peer recovery specialist. So whenever a friend of mine that was with me this morning, and she's also a CPRS, and we're both in higher education, to even put on our signature line in our email CPRS, that's showing anybody, any professionals, higher ups, on our resumes, anything. Oh, this person's got some baggage, right? This person has had tendencies, at least in the past, to resort to unsavory behavior. So we kind of put ourselves out there like that, but we do because it's for the greater good. So there's also stigma in even just trying to better yourself when you're even in recovery. And the end of this, I'm just going to wrap it up real quick. How to become a CPRS. It is as simple as, well, tn.gov is not simple, but is to just type into Google CPRS certification, and up will pop up the application process. It is a 2-part application. Anybody, if you identify as somebody that has been in recovery for depression for 2 years and has felt that you are able to become a certified peer recovery specialist, if you are somebody that identifies as somebody as both substance use disorder and mental health, you can apply it. You just have to submit transcripts and fill out, it's like a short answer application, and you'll do a 40-hour training if your application gets approved. And then after this is the big one that not a lot of people realize, after the 40-hour training, you're not certified yet. You have 75 hours of volunteer work as a peer one-on-one that is required before you are fully certified with the state. And you also have to be supervised. So just like any other profession in the behavioral health community, you have to have a supervisor, and that can be not just a CPRS, that can be an LCSW, LBSW, a therapist, LPC, all sorts of things. So yeah, I know I tend to talk fast, but that's it.
That was a wonderful rundown of your amazing role and how you approach it and how others can become just like you, Veronica. Thank you.